Good evening, and thank you for coming to this public service announcement, the flu virus. My name is Odette Foster. I'm a Master of Science nursing student at Aspen University. So a little bit about myself. I graduated in 1994 with a degree in sociology with a minor in history. I didn't really think about nursing until a few years later. Although the job market opportunity was hard at the time, I really felt a calling to do nursing. So I went back to school and graduated for the second time in 1999 with an associate degree in nursing. I continued my career as a professional for 20 years in various aspects of nursing: med surgical floors, ICU, psychiatry, and Department of Corrections. I am currently studying in Public Health Master Science program at Aspen University. In order to understand the influenza disease, we must look at its history. The world has experienced many pathogens that have threatened humanity. Before the first vaccine was created to reduce an individual's likelihood of contracting these symptoms or dying from the disease, protecting each individual from becoming susceptible to these diseases were vital. When pathogens are not contained within our communities, they can spread nationally and globally. Our world has had many pandemics in the past. The novel influenza A virus was caused in 1957 to 1958. In the 1970s, the H1N1, the swine flu. In 1996, the avian flu, the H5N5. And today, we are currently dealing with the coronavirus in 2020. During this public service announcement, I will explain the history of the influenza virus, the myths and misconceptions, and the future of vaccines today. The last flu pandemic was in 1918, the H1N1 virus, which affected 500 million lives globally, which was 1/3 of the global population at that time, claiming 50 million lives worldwide and 675,000 American lives. All ages were affected, from the young, under 5 years, to seniors over 65. Surprisingly, adults between 20 and 30 with no pre-existing symptoms were experienced high rates of deaths. With no vaccine available and no antibiotics to treat the symptoms, this pandemic was brutal throughout the world. During these years, the best intervention available was isolation, increased use of disinfectants, and masks, similar to what is happening today in our current situation with the coronavirus. In order to stop the spread of future pandemics, all levels of government, local, state, federal, must work together to protect you and I from communicable diseases. Local health departments work to increase accessibility and vaccination rates. At the state level, healthcare organizations, businesses, and schools must create pandemic planning to respond to a real-life threat from a communicable disease outbreak. At the federal level, consistent assessment of the risk of influenza will pose that could escalate to a pandemic risk is necessary. The myths surrounding the influenza virus and the vaccines available are many. In this public service announcement, we will touch upon 4 myths and facts about the influenza vaccine. Myth 1. The flu vaccine doesn't work. The flu vaccine effectiveness rates for influenza strain A of this virus is currently at about 40 to 60% of likely pathogens circling within any given season. However, by getting vaccinated, an individual benefits by first preventing influenza-type illnesses by 45%, 2, reducing the severity of the disease, and lastly, decreasing, if you should get it, hospitalization, stay, and the potential of dying from the influenza virus. There are organizations like the National Opinion Research Center, NORIC, which has been providing nonpartisan analysis of business and government policies since 1941. NORIC's aim is to transform increasingly complex information into useful knowledge, along with conducting its research that is based on reliable scientific data. According to Caroline Pearson, Senior Vice President of NORIC at the University of Chicago, reports that the news media has been increasing the fears within the public. News reporting often focuses on whether the scientific community will be able to develop the correct vaccine to fight the dominant strains each season. Peterson continues to say, remember that regardless of whether the vaccine is a good match, it will be able to protect you from the infectious flu pathogens. It will reduce the likelihood of you getting sick and reduce the severity of symptoms if you were to become ill. Myth number 2, the side effects. Makes it not worth getting vaccinated. The influenza vaccine, which is commonly given intramuscularly, is available under various brand names. One brand name, Fluzone Quadrivalent, is made by Sanofi Pasteur. The adult dose in one is 0.5 of the drug intramuscularly. Adult clinical trials have reported varying degrees of side effects lingering 3 days after injection, but the rates are low. Listed below are some of the common complaints. For example, redness at the injection site. 1.1% of people will be affected. Swelling at the injection site. 0.5%. Malaise, 10.2%. Headaches, 15.8%. Muscle pain, 23.7%. And the one we all know, pain at the injection site, 47.4%. However, it is possible for an individual to have a life-threatening allergic reaction, but this is rare. When it happens, it's usually due to the person having a reaction to the components of the vaccine, like the egg protein or other ingredients used to make the vaccine. However, the flu vaccine can still be given to individuals with mild egg allergies, like hives. Individuals with more serious allergic reactions can be vaccinated, but they need to be monitored under medical supervision for an anaphylactic reaction. Myth number 3, for those who do not want a flu shot, the flu vaccine can also be administered nasally through a mist. Since 2003, the FDA approved FluMist Quadrivalent. It was approved for individuals between the ages of 2 to 49 years old. It is administered nasally. Dosing depends on the patient's age. 2 years to 8 years, 1 to 2 doses are administered no less than one month apart. Ages 9 to 49, 1 dose FluMist is supplied in 0.2 mL of a pre-filled intranasal spray, of which half of the syringe is administered in each nostril. So easy. Myth number 4. I often hear this one. I get the flu after I get the flu vaccine. During the course of the flu season, many respiratory pathogens are circling within the environment, like the rhinovirus, which is the common cold. The flu vaccine will not protect you from them. It can only protect you from the dominant flu virus strain that is circulating that season. Individuals sometimes wait too long before becoming vaccinated, and during the 2 weeks waiting period for the influenza to develop immunity, they become infected with the virus. These myths and many more have been circulating in our communities despite public health initiatives to educate its citizens, perhaps providing us with some insight to why vaccination rates have been less than optimal. According to the American Academy of Family Physicians, survey identified that the myths and misconceptions around the vaccine, that 32% of American adults said they did not plan to get vaccinated during the current flu vaccine season 2019 to 2020. The survey represented participants who were between the ages of 25 to 73 years old. It concluded that millennials, individuals born between 1980 and 1994, and African Americans held strong anti-vaccine rhetoric. As a nation, we are moving towards a universal flu vaccine. The National Institute of Allergy and Infectious Disease reported in April 2019 that they were able to display part of the hemagglutinin, an influenza protein, on the surface of the microscopic nanoparticle made of non-human inferin. The hopes is that humans would have to only take one vaccine to help them with the influenza and its subtypes 1 and 5 influenza strains. Currently, a vaccine called Flu-V has been proven to be effective during the trial phases. Dr. Maloney said that the infectious disease suggests that cellular immunity may be very important and necessary component of future broadly protective universal influenza. Getting vaccinated protects you, but it also protects your loved ones. That is because of a concept called herd immunity. The logic behind this concept is that when more people become vaccinated, then less people are affected. Herd immunity happens when individuals get either vaccinated or develop antibodies as a result of exposure. Other people in the community become protected because there are significant and sufficient amount of individuals who cannot spread the disease to others. The herd effect measures the amount of people who benefit from not catching the disease because of the herd immunity. Dr. Michael Bradley, the medical director at the Nationwide Children's Hospital in Columbus, Ohio, stated, "The whole principle is if you give a vaccine to someone, you protect them from being affected, but you also prevent them from transmitting the disease to others." But for it to be effective, there is a threshold somewhere between 93 and 95% of people who must be vaccinated for any given disease. For example, to get herd immunity for the influenza virus would require 80% of healthy people and 90% of at-risk individuals to be vaccinated. In conclusion, the number of people who participate in influenza vaccination is astonishingly low at approximately 44%, dating back to 2014-15. The reason for low vaccination rates are many, from lack of access, affordability, or personal resistance based on one's belief. Healthcare leaders are working towards breaking down these barriers and educating publicly in hopes to increase vaccination rates in our community. The Healthy People 2020 goal has implemented a systematic approach that rejects the status quo, establishes interventions at all levels of government, and promotes effective, evidence-based public health initiatives to decrease the spread of the influenza virus. Thank you for joining this webcast on influenza virus. If you have any questions of anything that I did not explain today, you can email me at msarosebud@gmail.com. But most importantly, I do have a survey that I would like you to complete. It is at SurveyMonkey, and the link is below.